You know that about 8 million people in the world suffer from peptic ulcer disease, and in Africa, about 15 out of every 100 Africans suffer from this same disease. That makes it a global health challenge. And to lead us to our topic for today, which is peptic ulcer disease. So in this video, we're going to be learning about peptic ulcer, the causes, the pathophysiology, management, and the complications that can arise from untreated peptic ulcer. So grab your pen and paper, let's study together. You may want to ask yourself, what is peptic ulcer disease? Peptic ulcer disease, it has to do with an injury in the gastric mucosa. To break it down, anytime you hear the word ulcer, it has to do with an injury in the body. So think of peptic ulcer as an injury in the gastrointestinal tract or the digestive system. We can't do justice to peptic ulcer disease without knowing the anatomy of the stomach. So let's dive into a brief anatomy of the stomach so that as we go on in this lesson, we're going to understand it better. Now, the stomach is a J-shaped organ located in the abdominal cavity and is a temporary storage space for food that we eat. Also, in the stomach, food is also broken down to smaller molecules so that digestion can take place. And after the food is done, after the stomach is done with its business with the food, it channels it down to the small intestine. And between the stomach and the small intestine, there is a link called the duodenum. It is a small pathway that is located in between the stomach and the duodenum. If you look at the uppermost part of the stomach, we're going to find a sphincter there. What that sphincter does is to lock that place up so that food from the stomach won't go up into the esophagus. That sphincter is known as the cardiac sphincter. And at the base of the stomach, there is also a sphincter that controls the movement of food from the stomach into the small intestine. And that sphincter is known as the pyloric sphincter. The stomach and duodenum has 4 layers, which are the mucosal layer, the submucosal layer, the muscularis layer, which is a layer of muscles, and it has to do with smooth muscles that are under involuntary control. And then the outermost layer of the stomach is the serosa. From the innermost to the outermost, we have the mucosa, the submucosa, the muscularis, and the serosa. This peptic ulcer disease mostly starts from the mucosa. So when there's a problem with the mucosa, we can see that this person has peptic ulcer disease, although it could be in the stomach or in the duodenum. When it is in the stomach, we call it gastric ulcer, and when it is in the duodenum, we call it the duodenal ulcer. Also, this stomach that we're talking about produces acid. And you all will agree with me that acids are corrosive, but then this acid is needed in digestion of food, thanks to the mucosa that protects the stomach from the effects of this acid. Also, the stomach has other protective mechanisms against this stomach acid, which are the bicarbonates and the prostaglandin. The bicarbonate plays a role in acid-base balance, and we've discussed that in a previous video. So I'm going to leave an info card up there so that you can click on it and go and watch that video on acid-base balance. Also, we have the prostaglandins. In our previous video when we talked about NSAIDs, we said that NSAID breaks down prostaglandins. And the function of these prostaglandins in the stomach is to build up the stomach lining and prevent it from the effects of gastric acid. So now, what causes this peptic ulcer disease? We have 2 major causes of peptic ulcer disease. The first one, which is an infection by a bacterium known as the Helicobacter pylori bacterium. If there is an infection with this bacteria, it could cause peptic ulcer. Another cause of peptic ulcer disease is prolonged use of NSAIDs, which are the non-steroidal anti-inflammatory drugs. We've already discussed non-steroidal anti-inflammatory drugs in our previous video, so I'll also leave an info card there so that you can go and see the video for yourself. Now, let's go back to the pathophysiology so that we can see how these NSAIDs and H. pylori infection can cause ulcer. The first we are going to look into is the mechanism of mucosal injury. It has already been established that the mucosa protects against the effect of the acid on the stomach. When there is an imbalance between the protective factors and the aggressive factors, there will be peptic ulcer disease. Let me explain that. When this H. pylori infection or NSAIDs have disrupted the gastric mucosa, it's going to make the mucosa have a less protective effect on the stomach lining, thereby causing peptic ulcer. Because the H. pylori eats up the gastric mucosa, while the NSAIDs try to wash it away. So it's going to cause peptic ulcer in the body. You will also agree with me that NSAIDs have an effect on prostaglandins. Trying to say that it breaks it down. And these prostaglandins are responsible for building up the gastric mucosa. So when there is less prostaglandins in the body, the person is prone to have peptic ulcer disease. So now you agree with me that it is not hunger that causes the peptic ulcer disease, as most Nigerians would think. Rather, it is the effect of an imbalance between the protective factors and the aggressive factors in the stomach. Now, what are the clinical features of peptic ulcer disease? If a patient has peptic ulcer disease, you are going to see the following symptoms. You have nausea, bloating, belching. This person is also going to complain of severe abdominal pain that could radiate to the back. Here comes the difference between the symptoms of gastric ulcer and duodenal ulcers. In gastric ulcer, the pain worsens with food. This is because when food is ingested, it triggers the stomach to produce more acid. And because there is a wound in the mucosa of the stomach, the acid now is going to directly affect the stomach instead of acting on the food. With duodenal ulcer, on the other hand, the pain is relieved by food, although it would get worse later. This is because as the food is ingested, the pain will reduce. When the food has mixed with the gastric acid, as it passes through the duodenum into the small intestine, the pain is going to become worse because acid is going to attack the duodenum. I believe with this you've understood the difference between gastric ulcer and duodenal ulcer. These three symptoms I'm going to give to you are red flags in ulcer patients. The first one is weight loss. When there's severe weight loss in a patient with ulcer, you know there's a severe problem and this patient needs to be attended to immediately. Also, when there is melena, melena is also known as blood in stool. If you see blood in the stool, it tells you that there is active gastric bleeding. This is a medical emergency, so this patient should be rushed to the hospital so that there won't be further complications of the peptic ulcer. Another danger sign you should watch out for is hematemesis, also known as vomiting blood. So if this patient is vomiting blood, it shows that there is bleeding in the stomach. That is why this patient is vomiting out blood. So it is a red flag and has to be attended to immediately. Otherwise, there could be perforation of other organs or peritonitis, which could lead to sepsis. Now, the diagnosis of peptic ulcer. How do we make diagnosis for peptic ulcer? The first thing we're going to do is history taking. This patient is going to give you a history of severe abdominal pain. You also want to run some laboratory investigations to confirm the diagnosis of peptic ulcer. This includes the complete blood cell count. The complete blood cell count is going to show that there is a high level of leukocytes. This is because the body is trying to fight an infection. So the leukocyte or white blood cell level is going to be elevated. You also want to do a stool analysis for fecal occult blood. This refers to hidden blood in the stool. There could be blood in the stool, but you may not know that there is blood in the stool. So this test is going to reveal if there is any kind of blood formation inside the stool, and this indicates active gastric bleeding, and it is a danger sign. You also want to run tests like H. pylori test. The presence of the H. pylori bacteria in the sample tells you that this patient is already having peptic ulcer disease. And here comes the gold standard for diagnosing peptic ulcers. This is the endoscopy. This endoscopy is a kind of invasive procedure whereby a camera is inserted to go and monitor how the gastric lining is faring. It's going to help you to visualize the mucosa of the stomach and the duodenum to know if there's any ulceration of the mucosa. We've already said a lot about peptic ulcer disease, so now let's look at the management of this disease. Generally, this disease is managed by a combination of three drugs, which are the antibiotics, the proton pump inhibitors, and the antacids. The function of the antibiotics there is to fight the bacteria, while the function of the antacid is to neutralize the stomach acid so that the effect will be less on the patient. And then the function of the proton pump inhibitors is to reduce the amount of gastric acid that is produced in the body. Although in cases of peptic ulcer where there is no H. pylori infection, the antibiotics can be removed from the treatment option because the patient does not need it. In this case, managing these patients will focus on administering the proton pump inhibitors, the antacids, and also to stop any form of NSAIDs this patient is taking so that it's not going to complicate the ulcer. And the complications that could arise from this peptic ulcer disease are as follows. We have the gastrointestinal bleeding. The stomach acid can continue corroding the layers of the stomach, and when it finally meets the blood vessels, it's going to eat them off. And that's when you start seeing symptoms like presence of blood in the stool or presence of blood in the vomitus. There's also going to be perforation which could lead to peritonitis or sepsis. So you don't want this for a patient at all. So that is why you should manage peptic ulcer disease properly so that there won't be peritonitis or sepsis. Now the greatest complication of this peptic ulcer disease is malignancy. Yes. Now, if peptic ulcer is not properly treated, it would cause cancer in the body. If you have further questions about peptic ulcer disease, why not leave them in the comment section? And don't forget to like this video and subscribe to this channel so you're not going to miss out on any of our new uploads. And until then, keep learning, keep caring.